Hello everyone, this video is a quick run through or a crash course on the obsessive compulsive disorder. And this is actually my report in one of my classes called Psychopathology and AGS. So I'm actually just recording this for future references or future purposes. And this might also be helpful for those who are trying to research on this. So I hope you'll bear with me because a lot of the terms here might be technical since the information I got here is from DSM-5, and then we have to also dig and explore deeper or explain the criteria of the criteria of OCD in DSM-5 extensively. Okay, but I'll just try to make it as quick and simple as possible. Okay, so I started this report in class by presenting this phrase, na-OC ako. And a lot of my classmates reacted by, I asked them if they often use this phrase. And they said a lot of them would use this, and mostly they would use this whenever they have thoughts of wanting things to be perfectly organized or cleaned. And it really is associated with orderliness, cleanliness, and things of that sort. So this phrase actually, I think, came from the disorder OCD itself. And let's look further into what this disorder really means. So not someone who says no OC ako doesn't mean that they really have OCD. So it's actually much more complicated than that. So let's get into it. What is OCD? OCD is characterized by the presence of obsessions and or compulsions. So you'll learn more about that. Obsessions are recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted, whereas compulsions are repetitive behaviors or mental acts that an individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. So you'll have a better clue in this picture where this girl just keeps looking, have these thoughts or images about her own obsessions and about the compulsions that comes with the obsession. So what are obsessions and compulsions? So for us to better understand this, here are some examples. A common obsession for people with OCD is having contamination. So like they fear germs and contamination with dust, household chemicals, or environmental pollutants. So then whenever they have these kinds of obsessions or thoughts, that often leads to compulsions. So compulsions is, and for example, like if you have fear of germs, it will lead to washing and cleaning, like repeated hand washing, excessive, take note of the term excessive showering or cleaning household items, or doing other things to prevent or remove germs and contaminants. So they actually really can be extreme when it comes to washing and cleaning. So it's true that we don't want germs. There are times that we really just keep washing our hands, but what is different when it comes to the person who has OCD is that they do it excessively. They do it repeatedly. So another common obsession is that they losing control, which is the fear of acting on an impulse to harm others or oneself, fear of insults or stealing things. So what they do to respond to that obsession is the compulsion of checking, which is they check repeatedly that they didn't or did not harm others or themselves or made a terrible mistake. Other obsessions are being suspicious about lucky and unlucky colors or numbers, getting over concerned about catching certain disease like cancer, concerned about being perfect or performing tasks perfectly, fear of losing things. Other compulsions are repeating routine activities, body movements, ordering and rearranging the things in order repeatedly, canceling or undoing, avoiding situations which trigger obsessions. Now, let's look into the diagnostic criteria. So the goal here is that we were asked by our professor to really look at the criteria and understand it very well so that we'll be able to differentiate someone who really has OCD and someone who do not. So let's try to understand what are obsessions. Okay, so the first criteria with that is that someone with an OCD has a presence of obsessions, compulsions, or both. And obsessions are defined by these two things. So the first one is that they are recurrent and persistent thoughts. They could also be urges or images that are experienced. So at some time during the disturbance, as intrusive and unwanted, and that in most individuals cause marked anxiety or distress. So there's actually nothing wrong about thinking that your hands are dirty. And so the difference of that when it is an obsession is that it's very intrusive. So even though you don't want to think about it, it just keeps, it just keeps repeating in your mind that my hands are dirty, even though it's not dirty already. So, and it's also unwanted. That means even though they don't want to think about it, they just can't help but think about these kinds of thoughts. So they're also recurrent, they keep happening, and they're also persistent. They're always there at some point, and it really causes a lot of distress and anxiety for the person. And another definition of obsession is that the individual attempts to ignore or suppress such thoughts, urges, or images, or to neutralize them with some other thought or action. So an example of that is that they perform a compulsion. So they actually know that their thoughts are unhealthy. So people with OCD just can't, they try to ignore these thoughts. They know that it's not helping them and they try to suppress them or neutralize them. And what they do in order to do this is that they have to do a compulsion. And with that, compulsions are defined as repetitive behaviors such as hand washing, ordering, checking, just like what we've looked at some examples earlier, or mental acts. So an example of a mental act is they keep praying, counting, repeating words silently that the individual feels driven to perform in response to an obsession or according to rules that must be applied rigidly. So they think that they really have to do these things or else their hands will, suffer, or they really have to do this rigidly. There are people who can, withstand having their hands dirty. Like, okay, it's okay. I recognize my hands are dirty. I'll wash it later when I get to the sink. But for these people, they really have to perform. They really have to really do it extensively and repeatedly. And then another definition of compulsion is from the DSM-5 is that these are behaviors or mental acts that are aimed at preventing or reducing anxiety or distress, or preventing some dreaded event or situation. However, these behaviors or mental acts are not connected in a realistic way with what they are designed to neutralize or prevent, or are clearly excessive. So like what I mentioned, people who have the obsessions really have anxiety and great distress. So these compulsions are aimed at preventing the anxiety they're feeling. And if I also encourage you, if you want to see a picture of this, so you'll better understand how it looks like with someone who have compulsion and someone with obsessive obsession. So you can further watch videos on YouTube. I've seen a lot of videos about the life of an OCD, and it's very tough. And then for us to diagnose someone with OCD is that the obsessions or compulsions are time consuming. So an example of that it should take their obsessions or compulsions should take more than 1 hour per day. So it's not something very instant, but it's really it can be very time consuming, and it causes clinically significant distress or impairment in social, occupation, or other important areas of functioning. Actually, later I'll be giving examples of how people with OCD relate with their circle of friends and other relationships. Okay, so let's also take note that young children may not be able to articulate the aims of these behaviors or mental acts. And then another criteria is that the obsessive compulsive symptoms are not attributable to the physiological effects of a substance or another medical condition. So we have to rule out that it's not their compulsion or their obsessions are not related to a substance that they're taking. So let's say maybe a person is taking some sort of drug, or they have drug abuse that's causing the obsessions and compulsions. So it should not be that. And then the last criteria is actually very long, but this is actually just saying that the disturbance is not better explained by the symptoms of another mental disorder. So like there's generalized anxiety disorder or body dysmorphic disorder. So that's why it's very important that whenever we try to diagnose someone with OCD, we have to rule out other disorders that are similar, that are somehow similar to people who have obsessions and compulsions. So like here, an example is that they may be preoccupied with their appearance, as in body dysmorphic disorder. So we have to rule out that, okay, someone who has a preoccupation appearance may not actually be someone with OCD, but it might be body dysmorphic disorder. Okay, so there are other criteria in the different disorders that we also have to check so that we won't like mistaken them as OCD. Okay, so you can just read this if you want on your own. And this is the differential diagnosis. So again, as I was saying, these are the common disorders that can sometimes be mistaken as OCD. So we have to rule out, and we have to be keen about these different disorders as well. So the different diagnosis would be and other anxiety disorders or major depressive disorder, other obsessive compulsive and related disorders, eating disorders, tics and stereotype movements, psychotic disorders, other compulsive like behaviors, and obsessive compulsive personality disorder. And we actually discussed this in class. Obsessive compulsive personality disorder is different from OCD. A person can actually have a comorbidity wherein that person may have the obsessive compulsive personality disorder and OCD at the same time. But we also have to be aware that they are not the same. These two disorders are different. Okay, and then there's also specification. So someone who has good or fair insight recognizes that their beliefs are probably not true, or may not be true. So for example, they think that they know that their hands are no longer dirty, but then they just can't help but clean their hands. They know that they really know that the compulsions or the obsessions are not true, probably, but they just can't help it. And someone with poor insight is that the individual thinks obsessive compulsive disorder beliefs are probably true. So this is in the middle of good and absent insight, which is the individual is completely convinced that the beliefs are true. Like, you really can't help it. I really think it's true. My hands are dirty. It's always dirty. And then we should also specify if it's tic related. wherein the individual has a current or past history of a tic disorder. Okay, now let's look into how does OCD affect relationships. Someone with OCD can begin to feel like a burden, aware that he or she needs to repeat behaviors isn't rational, but still feel unable to stop. So as I've been saying before, they want to stop, but they just can't. They may become isolated with their obsessions. So that means they are unable to control them, even as with the awareness of the negative effect they're having on their life and relationship. So because they have these obsessions, some of them, resolve to isolation, since they can control their obsessions and they know how negatively it affects the relationship. Some would, just isolate themselves, and that's really sad. And according to the DSM-5, there is a 12-month prevalence of OCD in the United States, which is 1.2%, with a similar prevalence internationally, which is 1.1 to 1.8%. So mostly females are the ones that are affected, or slightly higher than the males when it comes to adulthood. But most of the males are commonly affected in childhood. So what is it like for someone who suffers OCD when it comes to having romantic relationships or having a spouse? So they often have heightened sense of fear and lack of security. And this sense of fear can manifest itself in the need for constant reassurance from their partner or spouse. So this is actually something they might struggle with. So since they have lack of security of maybe my partner or my spouse does not love me anymore, they have obsessions or compulsions that may hinder the things that they can do with each other. So they may actually need a lot of constant reassurance that, you're accepted, you're loved. I accept you even though you have those things, even though you struggle with that. So it's something that they actually may keep wanting reassurances from their partners. Then they also have problems with physical closeness, like being touched and overall affection. This is especially for those who have obsessions and compulsions when it comes to germs. So like they may hesitate or to, have touching of hands and being intimate with their partners. And, overall, when it comes to the affection or physical closeness, they may have a problem with that when they have that kind of compulsion, when they have those kinds of fears. And then partners may become exasperated or exhausted by the effort of navigating around their compulsions. So this is also something that partners should be aware about. They also need to have their self-care, and they might also need to have, their seek help or support from others so that they know what it feels like to have a partner who has OCD. Because it can be very exhausted, especially when a partner has a love language of touch. It's going to be hard for those who have obsessive compulsive when it comes to that area. Like it's going to be hard for their partners to not, experience the affection they can get, and other examples. Then I've also seen and found out from my research that there is something called relationship OCD. And it is a form of obsessive-compulsive disorder in which people experience intrusive thoughts and compulsive behaviors related to their relationship with their romantic partner. Like they might have thoughts of maybe I should have a better partner. Maybe I'm not right for this partner. So you can research more of that if you're interested. And then a person also can have problems in relating to their friends and family, some with OCD. So the family and friends allow time, space, and energy for someone with OCD to carry out these rituals and may find themselves deeply involved in these behaviors. So since their family members are the people with OCD has these rituals like for example, checking if you have locked the door before leaving your apartment. So sometimes they have these obsessions that, oh, my house is going to be in danger, I didn't lock my door, so they keep going back and going back. So what happens is that the family and friends may get involved in these behaviors, and sometimes they may also get affected too. That as we've also learned in our class, anxiety is actually contagious. So whenever a person who goes through anxiety and distress may actually pass it on to people around them, which is why the family and friends may sometimes, and it's possible that they would also be involved in these kinds of behaviors. That, oh yeah, did I also lock my door? Did I also check if I closed my stove? There. And then participating in these compulsions can be difficult, demanding, tiresome, and continuously test their patience, as they may struggle with having to assume responsibility and care for many daily tasks that the OCD sufferer isn't able to manage, leading to distress and disruption for everyone. Since someone with OCD their compulsions can take a lot of time, since they are time consuming. They may assume responsibility for the tasks that someone with the OCD cannot manage. And it can be very difficult for these people, for these family members and friends. So that's why self-care is very important as well. And then when it comes to work, due to anxiety and compulsions, an OCD sufferer in the workplace may have trouble with things such as productivity, performance, and punctuality. So like, for example, the situation mentioned a while ago, whenever the person kept going back to apartment because she or he forgot to lock the door, so he repeatedly checks the door. So that might affect the punctuality. That person might not be able to get to work on time because he has to deal with the rituals. And then it might also affect the performance. And someone who has OCD, some of them may suffer like a perfectionism that is very rigid. So like they constantly have to check, like there's an example where a girl constantly has to check the email she wrote many times before she could send the email. So they can really have a lot of trouble with these kinds of things in the workplace. Okay, so for the prognosis, if OCD is untreated, the course is usually chronic, often with waxing and waning symptoms. Some individuals have an episodic course, and a minority have a deteriorating course. Without treatment, remission rates in adults are low. So an example of that is that 20% for those reevaluated 40 years later. Then onset in childhood or adolescence can lead to a lifetime of OCD, which is why whenever we recognize that someone has a disorder as early as possible, we want to help them be treated as soon as possible. And then 40% of individuals with onset of OCD in childhood or adolescence may experience remission by early adulthood. So it is possible that even though they have OCD in childhood, it can be vanished when they turn to adulthood. So the course of OCD is often complicated by the occurrence of other disorders. So like if they have other disorders like body dysmorphic disorder and other disorders that can cause distress. So it can really complicate the OCD itself. And then in some people with OCD, the condition may be accompanied by other problems such as depression or anxiety. What is more, some complications could be a consequence of the patient's OCD. That is when someone obsesses about contamination and repeatedly washes their hands, they may develop skin problems as a symptom of their OCD. So like what I was mentioning earlier, if they don't get treated for this, like the one with the obsession or a compulsion of washing hands repeatedly, they may actually develop other, skin diseases, or it may lead to other physical symptoms or physical diseases. Now, so how do we treat? If you are a practicing therapist, counselor, this is just my research on how we can help, or what is our treatment plan for people who have OCD. So these are the most common therapy I found would be the cognitive behavioral therapy, and that includes the exposure and response prevention, the cognitive therapy, imaginal exposure, and habit reversal training. So in the CBT, I found this obsessive compulsive disorder SATNAV in one of our books in our theories class, theories of psychotherapy. So these are some examples, like, so a shorter example would be like, if you want to target excessive responsibility, like they think that they have to take responsibility for this and that excessively, then maybe a treatment strategy for that would be the responsibility pie. Okay, so, and then maybe they have overestimation of danger. So let's say they think, I'm going to get into an accident, I'm going to get an injury. So a strategy for that would be the distillation of realistic probabilities. So sometimes whenever we have the treatment for CBT, we could give them assignments. So like they can make use of the mood chart, which is stands for monitor mood, observe thinking, objective thinking, decide what to do, and do it. So these can be done when in between sessions, like whenever they are in their usual setting. So yeah, this is something that they can apply as well. And then what is imaginal exposure is for those who may be resistant to jumping right into real world situations. Imaginal exposure, sometimes referred to as visualization, can be a helpful way to alleviate enough anxiety to move willingly to ERP. So for us to, by the way, for me to mention exposure and response prevention, that is, this kind of technique is actually, you help the person you help the person sit with the anxiety. For example, let's say this person with OCD wants to keep everything organized all the time. So the technique to that is that, okay, let's say when you get home by 7 p.m., you can clean your house. But when the clock turns to this certain time, like when the news starts, you have to stop cleaning. So what's going to happen is that they are being exposed to the stimuli, which is the urge not to clean, and they just have to sit with that anxiety. So they have to refrain from doing their compulsions to their obsessions, and until they are able to be come with the kind of situations that, you know, they will be desensitized. They will no longer have these compulsions anymore. And that's actually called habituation. You get used. They were unable to, they're able to unlearn the compulsions they learned because they um, was helped to sit with their anxiety. So they'll discover, oh yeah, I guess there's nothing wrong when I don't get to clean my house, or when I don't repeatedly align my bookshelves. So they'll find out that, okay, I can survive even if I don't act on my compulsions. So the imaginal exposure is actually more about, so for those who can't do the ERP, this is the best substitute for that. So it's when you just imagine it. So this is done usually in a session in therapy that's gradually. So we don't want them to, you know, be traumatized by the treatment. So we have to do it carefully as well. And then another treatment would be the habit reversal training, which is, it says here, this intervention includes awareness training, introduction of a competing response, social support, positive reinforcement, and often relaxation techniques. Someone with a compulsion to touch things symmetrically may be directed to tense the opposite arm, holding it tightly against their body, preventing them from completing the ritual. So this one is like you're trying to reverse their habits by, like, you know, with these kinds of with relaxation or these kinds of techniques. Like they would, their regular compulsion like washing of hands can be substituted with another helpful non-destructive habits. Okay, so that's basically my research, and these are my references. So thank you so much for listening.